day, everyone. I am Kaya, and together with me is
Divine.
and today we're going to discuss about drugs for endocrine disorders. So first, let us define what is pharmacology. Pharmacology is the scientific study of the effects of drugs and chemicals on living organisms, where a drug can be broadly defined as any chemical substance, natural or synthetic.
Next, what is a drug? A drug is any chemical substance that causes a change in an organism's physiology or psychology we control. Drugs are typically distinguished from food substances that provide nutritional support.
Before we proceed to the drugs for endocrine disorders, let us first define what is endocrine disorders. So, endocrine disorders results from the improper function of the endocrine system, which includes the gland that secrete hormones, the receptors that respond to hormones, and the organs that are directly impacted by hormones. One of these points, dysfunction can occur and cause wide-ranging effects on the body. Drugs for diabetes mellitus. First, what is diabetes? Diabetes is a condition that leads to high levels of blood glucose or sugar in the body. This reaction happens when your body can't make or use the hormone insulin like it's supposed to. Produced by the pancreas, insulin helps your body use the sugar from the food you eat. There are two major types of diabetes. First is type 1 diabetes and type 2 diabetes. People with either type need medications to help manage their blood sugar levels. The types of medication you take will depend on the type of diabetes you have. For type 1 diabetes, if you have type 1 diabetes, your body can't make its own insulin. The goal of treatment is to replace the insulin that your pancreas can't make. Insulin is the most common type of medication used in type 1 diabetes treatment, given as an infusion under the skin with the help of an insulin pump or as an injection. There are multiple types of insulin. They vary based on how quickly they start working, how long they work, and whether they have a peak level of action. The type of insulin you need depends on your body's sensitivity to insulin and the severity of your insulin deficiency. This includes the following. First is the short-acting insulin. Regular or short-acting insulin may reach the bloodstream 30 minutes after injection and peak 2 to 3 hours afterward. This injection also works up to 3 to 6 hours. Types of regular insulin includes: first is Humulin or U100. Next is Novolin or Flexpen. Next is Novolin or Reliant. And Novolin or Flexpen Reliant. For the rapid-acting insulin, as the name suggests, rapid-acting insulin works within 15 minutes. The peak time is 1 to 2 hours after use, and the medication lasts between 2 to 4 hours. The available types of rapid insulin includes inhaled insulin or Afrezza, insulin aspart, Novolog Penfil, Reliant Novolog, Reliant Novolog Flexpen, insulin glulicin, insulin Lispro, insulin Lispro ABC. For the intermediate-acting insulin works about 2 to 4 hours after use with an average peak time of 12 hours. You can expect this type of insulin to last between 12 and 18 hours. Examples includes insulin isopane, Reliant Novolin, and Flexpen Reliant. For the long-acting insulin, long-lasting insulin helps lower your blood glucose levels for up to 24 hours or longer, and it reaches your bloodstream more gradually. The types of available long-acting insulin includes insulin degludec, insulin detemir, insulin glargine YFGN, and concentrated regular insulin. And these are for the combination of premixed insulins. Lastly is the amylinomimetic injectables. Pramlintide is an amylinomimetic. It is an injectable medication that is used before meals. It works by delaying the time your stomach takes to empty itself. It also reduces the secretion of the hormone glucagon after meals. These actions lower your blood sugar. Pramlintide reduces appetite too. Medication for type 2 diabetes. If you have type 2 diabetes, your body makes insulin but no longer uses it well. Your body can't make enough insulin to keep your blood sugar levels within an optimal range. The goal of your treatment is to help your body use insulin better or to get rid of extra glucose in your blood. Most medications for type 2 diabetes are oral drugs. However, insulin or injectables may also be used. Some of medications are combinations of more than one diabetes drug. Some people with type 2 diabetes may also need to take insulin. The same type of insulin used to treat type 1 diabetes can also treat type 2 diabetes. A doctor may recommend the aforementioned types of insulin used in type 1 diabetes treatment for type 2 diabetes. As with type 1 diabetes, this depends on the type of insulin needed and how severe your insulin deficiency is. Alpha-glucosidase inhibitors. These medications help your body break down starchy foods and table sugar. This effect lowers your blood sugar levels. When taken as prescribed, these medications won't cause hypoglycemia or low blood sugar. However, your risk at hypoglycemia may be greater if you take them with other type of diabetes medication. For best results, take alpha-glucosidase inhibitors before meals. This medication include acarbose and miglitol glycate. Next is biguanides. Biguanides decrease how much glucose your liver makes. They also decrease how much glucose your intestines absorb. Help your muscles absorb glucose and make your body more sensitive to insulin. The most common biguanide is metformin, Glumetza, Riomet-ER. Metformin is considered the most commonly trusted source prescribed oral medication for type 2 diabetes. It can also be combined with other type 2 diabetes medication. It's an ingredient in the following medications. Dopamine 2 agonist bromocriptine cycloset parlodel is a dopamine 2 agonist. It's unknown exactly how this drug treats type 2 diabetes. It may affect rhythms in your body and prevent insulin resistance. According to 2015 review trusted source, dopamine 2 agonist may also improve other related health concerns such as high cholesterol or weight management. Dipeptidyl peptidase 4 inhibitors. DPP-4 inhibitors are used to help reduce blood sugar without causing hypoglycemia. DPP-4 inhibitors block trusted source, the DPP-4 enzyme. This enzyme destroys a hormone called incretin, which normally helps your body produce insulin when it's needed. Incretins also decrease glucose output from the liver when your body doesn't need it. These drugs can also help the pancreas make more insulin. These are the examples of DPP-4 inhibitors includes like peptide-1 receptor agonists. GLP-1 receptor agonists are similar to incretin and may be prescribed in addition to a diet and exercise plan to help promote better glycemic control. They increase how much insulin your body uses in the growth of pancreatic beta cells. They decrease your appetite and how much glucagon your body uses. They also slow stomach emptying, which may maximize nutrient absorption from the foods you eat, while potentially helping trusted source you maintain or lose weight. These are all important actions for people with diabetes. For some people, atherosclerotic cardiovascular disease or heart failure or chronic kidney disease may predominate over their diabetes. In these cases, the American Diabetes Association, or DA, recommends certain GLP-1 receptor agonists as part of an anti-hypoglycemic treatment regimen. These drugs includes these medications help your body release insulin. However, they aren't for everyone. In some cases, they may lower your blood sugar too much, especially if you have trusted sources of advanced kidney disease. These drugs includes nateglinide and repaglinide. Sodium glucose transporter or 2 inhibitors. Sodium glucose transporter 2 inhibitors work by preventing the kidneys from holding on to glucose. Instead, your body gets rid of the glucose through your urine. Again, in cases where atherosclerotic cardiovascular disease, heart failure, or chronic kidney disease predominate, the ADA recommends SGLT2 inhibitors as a possible treatment options. Examples include sulfonylureas. These are among the oldest trusted source diabetes drugs still used today. They work by stimulating the pancreas with the help of beta cells. This causes your body to make more insulin. These drugs includes thiazolidinediones. Thiazolidinediones work by decreasing glucose in your liver. They also help your fat cells use insulin better by targeting insulin resistance trusted source. These drugs come with an increased risk of heart disease. If your doctor gives you one of these drugs, they will watch your heart function during treatment. And drugs includes next is drugs for thyroid disorder. Thyroid medications. The thyroid is the gland in your neck associated with metabolism, the process by which your body makes use of energy. Autoimmune thyroid disease is common in lupus. It is believed that about 6% of people with lupus have hypothyroidism, underactive thyroid, and about 2% have hyperthyroidism, overactive thyroid. A thyroid gland that is functioning improperly can affect the function of organs such as the brain, heart, kidneys, liver, and the skin. Hypothyroidism can cause weight gain, fatigue, depression, moodiness, and dry hair and skin. Hyperthyroidism can cause weight loss, heart palpitations, tremors, heat intolerance, and eventually lead to osteoporosis. Treatment for both underactive and overactive thyroid involves getting your body's metabolism back to normal. These are the thyroid hormone replacement. Thyroid replacement is used to treat people with an underactive thyroid, whether it is caused by autoimmune disease, radioactive iodine treatment, or surgical removal. The main medication used to treat hypothyroidism is levothyroxine sodium, a synthetic version of thyroxine, a thyroid hormone your body produces naturally. Other medications are also available, namely liothyronine, a synthetic version of another thyroid hormone called thyroidothyronine. Liotrix, a synthetic combination of T4 and T3, and desiccated natural thyroid hormone prepared from dried porcine, since these medications simply supplement a hormone that is missing. The only real safety concern is ensuring that you take the right amount. Therefore, your doctor will need to regularly check your thyroid and TSH levels to make sure you are receiving the correct dosage. The thyroid hormone stays in your body for a long time, so you will only need to take it once a day, usually in the morning. It is important to take this medication without food because food can affect your body's absorption of the hormone. In addition, remember to take your thyroid medication at the same time of a day, and do not stop taking your medication without first discussing the decision with your doctor. Many people need to take thyroid medication for the rest of their lives. Anti-thyroid medications or profityrosile, methimazole. Profityrosile and methimazole are medications used to treat overactive thyroid. They work by slowing down the production of thyroid hormone and do not cause permanent damage when taken appropriately. These medications can control hyperthyroidism in just few weeks. However, the main problem with anti-thyroid medications lies with the fact that the underlying problem returns once they are discontinued. Therefore, many people are encountered to seek more permanent treatments such as radioactive iodine treatment or surgical removal. Side effects of anti-thyroid medications include skin rash, upset stomach, drowsiness, and a bitter aftertaste. Rare but serious side effects include sore throat, fever, chills, jaundice, decreased white blood cells, and liver disease. Drugs related to hypothalamic and pituitary function. Hypothalamus and pituitary gland constitute an important neuroendocrine system that regulates growth, reproduction, metabolic rates, and other critical body functions. The pituitary gland is divided into two major lobes: the adenohypophysis, the anterior lobe, and the neurohypophysis or posterior lobe. Various hormones are secreted by each of these lobes and by the hypothalamus. These are the drugs related to hypothalamic and pituitary function: line, nafarelin, triptorelin, cetrorelix, degarelix, hestrelin. Drugs for disorders of the adrenal cortex. Chloromethylone, an ophthalmic corticosteroid, is used for the relief of inflammation located in both the palpebral and bulbar conjunctiva, the cornea, and the anterior segment of the globe of the eye. Beclomethasone, dipropionate, an inhaled corticosteroid, is used as a maintenance treatment in the prophylaxis of asthma attacks. Betamethasone, a systemic corticosteroid, is used to relieve inflammation in various conditions, including but not limited to allergic states, dermatologic disorders, gastrointestinal diseases, and hematological disorders. Triamcinolone, a glucosteroid, is used to treat a wide variety of inflammatory conditions of organ systems and tissues. Hydrocortisone, a glucocorticosteroid used to treat corticosteroid-responsive dermatosis, endocrine disorders, immune conditions, and allergic disorders. Bacteriostatic inhibitors of protein synthesis, tetracyclines, macrolides, and others. Bacteriostatic protein synthesis inhibitors that target the ribosome, such as tetracyclines and glycylcyclines, chloramphenicol, macrolides and catolides, lincosamides, streptogramins, and aminocyclitols. Macrolides and tetracyclines, macrolides, telithromycin, and clindamycin, which share a common binding site on the 50s ribosomes, also block transpeptidation. Tetracyclines bind to the 30s ribosomal subunit, preventing binding of amino acid charged tRNA to the acceptor site of the ribosome mRNA complex.
Aminoglycosides, bactericidal inhibitors of protein synthesis. Aminoglycosides have bactericidal activity in which they bind to the bacteria ribosomal 30S subunit. Specifically, they are believed to bind to the A site on the 16S RNA, a component of the ribosomal 30S subunit. Bacteriostatic protein synthesis inhibitors that target the ribosome, such as tetracyclines, glycylcyclines, chloramphenicol, macrolides, and catolides, lincosamides, streptogramins, oxazolidinones, and aminocyclitols. Sulfonamides and trimethoprim. Sulfonamides. The sulfonamide drugs were the first effective chemotherapeutic agents to be employed systematically for the prevention and cure of bacterial infection in humans. The advent of penicillin and other antibiotics diminished the usefulness of the sulfonamides, but the introduction of the combination of trimethoprim and sulfamethoxazole has increased the use of sulfonamides for the prophylaxis and treatment of specific microbial infection. Sulfonamides are derivatives of para-aminobenzene sulfonamide and are congeners of para-aminobenzoic acid. Most of them are relatively insoluble in water, but their sodium salts are readily soluble. On the other hand, trimethoprim is an antibiotic. It is used to treat and prevent urinary tract infections or UTIs, such as cystitis. Occasionally, trimethoprim is used to treat other types of infections, such as chest infections and acne. Trimethoprim is available on prescription. It comes as tablets and as liquid that you swallow. Drug therapy for urinary tract infection. Your medicines commonly used for simple UTIs include trimethoprim and sulfamethoxazole. Sold under the brand name of Bactrim, among others, is a fixed-dose combination antibiotic medication used to treat a variety of bacterial infections. It consists of 1 part trimethoprim to 5 parts sulfamethoxazole. Next is fosfomycin or Monurol. Fosfomycin, sold under the brand name Monurol, among others, is an antibiotic primarily used to treat lower UTI. It is not indicated for kidney infections. Occasionally, it is used for prostate infections. It is generally taken by mouth. Next is nitrofurantoin or macrodantin, macrobite, and furandantin. Nitrofurantoin is an antibacterial medication used to treat urinary tract infections, but it is not as effective for kidney infections. It is taken by mouth. Common side effects include nausea, loss of appetite, diarrhea, and headaches. Rarely, numbness, lung problems, or liver problems may occur. Next is cephalexin. This medication is used to treat a wide variety of bacterial infections. This medication is known as cephalosporin antibiotic. Next is ceftriaxone. Ceftriaxone, sold under the brand name Rocephin, is a third-generation cephalosporin antibiotic used for treatment of number of bacterial infections. Antimicrobial agents, drugs for tuberculosis, leprosy, and Mycobacterium complex infection. First is the drugs for tuberculosis. Rifampin. Rifampin exerts its effects by reversibly inhibiting DNA-dependent RNA polymerase, which further inhibits bacterial protein synthesis and transcription. Next is isoniazid. Isoniazid is a prodrug that is converted to its active form metabolite by catalase peroxidase and exerts its action by further inhibiting the biosynthesis of mycolic acid. Next is pyrazinamide. Pyrazinamide's mechanism of action remains unknown and not fully understood. Pyrazinamide is converted to its active form pyrazinoic acid and exerts its effect by inhibiting translation and possibly coenzyme, a synthesis needed for the bacteria to survive. And next is ethambutol. Ethambutol inhibits the enzyme arabinoacyltransferase and prevents the biosynthesis of the mycobacterial cell wall. Hansen's disease is treated with a combination of antibiotics. Typically, 2 or 3 antibiotics are used at the same time. These are dapsone and rifampicin, and clofazimine is added for some types of disease. This is called multi-drug therapy. The drugs most often used for treatment of Mycobacterium avium complex infection include a macrolide, example, clarithromycin and azithromycin, ethambutol and rifamycin. Clarithromycin or azithromycin is combination with ethambutol and rifampicin are the first choice drugs. Next, miscellaneous antibacterial drugs. Fluoroquinolones. The fluoroquinolones are a family of broad-spectrum, systemic antibacterial agents that have been used widely as therapy of respiratory and urinary tract infection. Fluoroquinolones are active against a wide range of aerobic gram-positive and gram-negative organisms. Metronidazole. Metronidazole is one of the mainstay drugs for the treatment of anaerobic bacterial infections, protozoal infections, and microaerophilic bacterial infections. It is cytotoxic to facultative anaerobic microorganisms. Daptomycin. Daptomycin is a cyclic lipopeptide antibiotic derived from the organism Streptomyces roseosporus. Daptomycin is used to treat various bacterial infections caused by gram-positive bacteria including methicillin-resistant Staphylococcus aureus and vancomycin-resistant Enterococci. Rifampin. Rifampin is a class of medications called antimycobacterials. It is work by killing the bacteria that cause infection. Antibiotics such as rifampin will not work for cold, flu, or other viral infections. Rifaximin is an antibiotic used to treat irritable bowel syndrome with diarrhea, reduce the risk of overt hepatic encephalopathy recurrence in adults, and treat travelers' diarrhea caused by non-invasive strains of Escherichia coli. Next is fidaxomicin. Fidaxomicin, sold under brand name of Difficid, among others, is the first member of a class of narrow-spectrum macrocyclic antibiotic drugs called chacomycins. It is a fermentation product obtained from the Actinomycet dactylosporangium aurantiacum subspecies hamdensis. Antifungal agents. Antifungal medicines are used to treat fungal infections which commonly affect your skin, hair, and nails. Types of antifungal medicines you can get antifungal medicines as a cream, gel, ointment, or spray, a capsule, tablet, or liquid, an injection, a pessary, or a small and soft tablet you put inside the vagina. Common names for antifungal medicines include clotrimazole, iconazole, miconazole, terbinafine, fluconazole, ketoconazole, nystatin, and antiviral agents. 1. Drugs for non-HIV viral infections. The neuraminidase inhibitors, oseltamivir and zanamivir, are the predominant antivirals used for chemoprophylaxis and control of influenza outbreaks. Both agents are worked by preventing release of new virus particles through inhibition of viral neuraminidase and are active against influenza A and B. Next is antiviral agents 2, drugs for HIV infection and related opportunistic infections. So first, what is HIV? HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS or acquired immunodeficiency syndrome. There is currently no effective cure. Once people get HIV, they have it for life. Treatment with HIV medicines is called antiretroviral therapy, or ART. ART is recommended for everyone with HIV, and people with HIV should start ART as soon as possible. People on ART take a combination of HIV medicines called an HIV treatment regimen every day. A person's initial HIV treatment regimen generally includes 3 HIV medicines from at least 2 different HIV drug classes, namely nucleoside reverse transcriptase inhibitors, or NRTIs, non-nucleoside reverse transcriptase inhibitors, or NRTIs, and protease inhibitors, or PIs. Next is drug therapy for sexually transmitted infections, or STIs. First is antibiotics. Antibiotics, often in a single dose, can cure many sexually transmitted bacterial and parasitic infections including gonorrhea, syphilis, chlamydia, and trichomoniasis. Once you start antibiotic treatment, it's necessary to finish the prescription. Next is antiviral drugs. If you have herpes or HIV, you'll be prescribed an antiviral drugs. You'll have fewer herpes recurrence if you take daily suppressive therapy with a prescription antiviral drug. However, it's still possible to give your partner herpes. Antiviral drugs can keep HIV infection in check for many years, but you will still carry the virus and can still transmit it. The risk is lower. The sooner you start HIV treatment, the more effective it is. If you take your medication as directed, it is possible to reduce the viral load in the blood so that it can't be detected. At the point, you will not transmit the virus to sex partners. Next is antiseptic and disinfectants. Antiseptics and disinfectants both kill microorganisms, and many people use terms interchangeably or interchangeably, adding to the confusion. Antiseptics are sometimes called skin disinfectants. So, what is disinfectant? A disinfectant can be defined as the antimicrobial agent that can be applied on the surface of some objects in order to destroy the microorganisms residing on it. What is antiseptic? An antiseptics can be defined as antimicrobial agents which can be applied on the body of living organisms to inhibit the action of microbes. They are not injected into the body like antibiotics, rather they are applied on the surface of the skin to heal the living tissue in case of wounds and cuts. Dettol is the most commonly used antiseptic. It is mixture of chloroxylenol and terpeneol, or iodoform is also used as an antiseptic for wounds. Types of disinfectants. Some common types of disinfectants include air disinfectants. It is defined as the chemical substance which are used to kill microorganisms that are suspended in the air. It can also be called as disinfectant spray. Next is alcohol. It is seen that alcohols are used as disinfectants. Ethanol is the most common example in this case. Some other examples of disinfectants are chlorine, when it is in the concentration of 0.2 to 0.4 in aqueous solution, and sulfur dioxide, which acts as a disinfectant in small concentrations. Types of antiseptics. Some antiseptics are germicidal in nature, implying that they have the ability to completely destroy microbes. These types of antiseptics are referred to as bactericidal antiseptics. Other antiseptics only inhibit the growth of microbes or prevent the growth of microbes altogether. Such as substances are commonly referred to as bacteriostatic antiseptics.